So this is something you may not even have realized. Do you know that babies need their first eye assessment, or basically eye exam, by the time that they're 6 months old? Sounds a little early, right? Well, here to tell us what parents and caregivers need to know when it comes to eye health and giving children those comprehensive eye exams is Dr. Jennifer Smith Zolman joining us. So Las Vegas says good morning to you, Dr. Zolman. You know, really interesting. I have never heard this. I've always heard of the importance of children getting their eyes checked early because, you know, they have problems, you know, in school and being able to read and, you know, see the board. But I didn't know infants needed eye exams as well.
So the American Optometric Association, they do recommend that infants have their first eye assessment or eye exam between 6 to 12 months of age. The main reason for this is a lot of those things that happen later when they're having problems with reading, or they find out that they aren't seeing so well of the other eye. That can be basically found in infancy, and we can start treatment earlier to prevent some of these developmental delays that may start later in life. About 80% of what we learn is through our vision. So even when we're babies learning how to walk and talk and about the world around us, that all comes through our vision. So we really want to catch any of those disorders in those early months so that we can nip it in the bud then.
Fascinating. You know, and I'm interested to know, since a child that young really can't communicate like one who's, say, 4, 5, 6 years old. I know you may not be able to, you know, describe all the different, you know, techniques you use, but how would you assess the child that young? Like, what would you do?
So the exam is actually very fun for the infant and for most of the doctors as well. But we use specialized lights and we use some lenses and we do some techniques. This is actually my son, Grayson. He was in the studio today, but I'm demonstrating some of the techniques there. But we use lights and lenses, and we use some different targets, and then we look at the way the eyes are aligning. We're looking for any risk factors for things like lazy eye, strabismus, and even big things like retinoblastoma, which is an eye cancer that can occur in babies.
That is fascinating. And by the way, your baby is a doll face too. What a great little model he was.
Thank you so much.
But that was really interesting to see, because I was wondering, how do you do something like that with a child that young? But Dr. Zolman, such great advice to pass along, just the importance of getting it done early and often, we should add as well. So thank you so much. Hopefully next time you're in Vegas, you'll stop by and see us.
Yes, and check out infancy.org for more information and a doctor locator near you.
Wonderful. Thank you so much. Have a good one, and we'll talk to you next time.